I think let's have a recap. What has been the learning from the previous session and any points to discuss. So I think each one of you must give at least one comment or one feedback so that I'm sure that we all are on the same page. So shall we start from Gurleen?
Sure, ma'am. Yes. So we discussed about the importance of communication and the role it plays in healthcare in providing a therapeutic treatment and holistic treatment to patients, and major causes of why it's gaining traction rapidly in the industry. Would you like me to go on, or should I?
No. Just one point so that others can also talk about it. And also, in case, was there anything that you wanted to clarify or you were not like clear about?
No, ma'am.
That's fine. You are okay with this. Okay. So can I request Dr. Samira to give her point, and also in case if you have anything that you want to clarify?
Thank you so much. Hi, everybody. In last week, we talked about the problems of ineffective communication. They are a major problem, and 80% of medical errors are due to miscommunication. So if we can improve our communication, we can avoid these medical errors. And also we discuss in detail about the advantages, not only medical errors, patient satisfaction, patient's adherence to treatment, accuracy and efficiency of our history taking, and the job satisfaction for healthcare professionals, and avoiding burnout.
So any questions about the last session? Anything that you wish to clarify?
No,
so
thank you.
With the content? Were you okay with the content? Did that make some meaningful this thing? Great. Thank you.
Thank you.
Thank you. Thank you. So Dr. Santwana, anything from the previous session that you wish to highlight or mention? Just one point is also okay, because everybody should speak a point about last program, and anything that you have for the next program on your mind, you can share now.
Sure, ma'am. Ma'am, I really appreciated, and I was quite happy for that particular the classroom session that we did on communication, and that actually helps us understand that where are the loopholes, and that's how we can work ahead. So I would definitely enjoy such kind of interactive sections, which is going to be like, that would remember, that you could put it in your mind and remember it forever. So it's the life situations.
Exactly. So, I think that is what is the purpose. Yes, I'm going to do all this with all of you so that you can experience it, and then you can take it when you have your own training programs, and you can integrate it. So that is why this is not just program on communication and you're master trainer. So it's going to work on your training skills as well. Yes. Okay. Thank you so much, Dr. Santwana. I think that feedback gives me satisfaction that we are on the right track. Thank you so much. So Mayuri, what is your response or anything that you remember of the previous class?
Everything was very good, but that one, proper documentation and means verbal communication, we have already discussed regarding that we have to do proper documentation, and also we have to maintain proper.
Okay, it's okay. I think Mayuri,
sorry, ma'am, that the network was not good. Yes, we have discussed regarding the importance of proper documentation and proper means verbal communication.
So you found it useful. You found it useful.
Yes, ma'am, definitely.
Okay. Thank you so much. Thank you. So Dr. Hemant, anything that you wish to add to what these people have said, and also any clarification to make?
Good evening to all, and good evening to ma'am. And it was a very enlightening session, and it made it sounded that what we are going to witness in few sessions and what will finally will become. So most of the things have been covered, and I'm looking forward to further enrichment of the knowledge. Thank you.
Thank you so much, Dr. Hemant. Thank you. Thank you. So Poonam, are you there? Can you have your video on if you're comfortable, or you want me to wait for a while?
My audio is not functioning properly,
No,
actually.
I can see your audio. I can see your audio. Like we can hear you. Sorry, I'm so
Yeah,
sorry.
yeah. But audio voice is not clear at my end. Like I cannot
see.
hear
Actually, you
you
have logged
properly.
in from 2 devices, Poonam.
Yeah,
So
I have logged in. So I have to cancel my phone one.
Yeah. It's better if you join from the PC, because then you will be able to see everybody also, and then we will also.
Yeah, I've done that.
Okay, but we can still see two login. From
still two.
Yeah, still two. So maybe you log out from both and come back. That's better.
Okay.
Whatever is comfortable, like whatever you. Okay. So meanwhile, Bindu, can I request you to give your feedback for the last session, or anything that you think you don't agree, or you wish to clarify? Because the idea is we should be able to openly, honestly share our thoughts about the.
Yeah, there were quite many takeaways, but what has stayed with me for these 3 days is 85% of our personal and professional success depends on our social skills, our communication, and our interpersonal skills.
So true.
I got to ponder over these lines a lot.
Normally we take them very lightly and we think it's not, but I completely agree that I'm glad that you like that part of it. Thank you so much. But otherwise you're okay with the direction we are going, the content.
Of course.
And I'm going to link what we have discussed and what we are going to discuss and why we are discussing that.
Of course.
We talked about it. Thank you.
Thank you,
Dr. Beauty, for joining. Thank you so much. Dr. Beauty, can you hear me? Although I
yes,
know you could not attend the program, you had little challenge in attending the program, but whatever you could see or attend, and I think you got to see the recording also. Did you get time?
So I did a little bit. Like I could not go through the entire recording because I finished my work just at 7 p.m. and then I had to.
I'll stop for a second.
Yeah.
From Renuka, let me take.
Sure.
Yeah, Renuka, tell me. Friends, I think there was some confusion and I don't know how 2 links got generated. Even I started a program 10 minutes ago on the different link. When Dr. Samira sent me the screenshot of the message that she was seeing, and when Bindu started calling, I realized that there's some confusion. Then I closed that meeting and started this one. So I'm sorry for the confusion. I'm really sorry for the confusion. Sorry, Beauty, you were saying something and I had to stop you. Please go ahead.
Yeah. So, ma'am, I was saying I could not go through the entire recording. I started it, and then because I finished my work at 7 p.m. and then I had to have something for dinner because this was gonna go till late. So I couldn't see the whole thing, but I do remember one thing very clearly. And I've been trying to learn from different sources about healthcare communication for past 1 year, and and also you mentioned, and I have experienced this, that in India, particularly healthcare communication is very, people don't know much about it. They only see communication as an act of talking English and smiling. That's all they understand of communication. And when I talk about training on communication, they think that I'm probably going to talk about corporate communication, how to stand, how to sit, and how to dress well. So that's something that I want to change, and I really want to do a lot in communication. I've been trying to learn from various sources. I've read books from all corners of the world on healthcare communication, and the reason I'm working with you because I have seen you do things in practice. Like till now, I have theory knowledge with me, but I want to put it into practice, and I want to learn that from you. I want to learn that from all of us here. Whatever we know, how do we implement it, and how do we really help the society, not just by keeping the knowledge to ourselves. So that's something I'm really looking forward to.
That's my promise to you, that we are not only going to learn and talk about theory, but we are going to learn what to do, how to engage the audience, and how to make people clear that communication, clinical communication is not just about niceties, like you're saying, because they think corporate communication is all about professional etiquettes and good behavior. That's one part. That's required. But clinical communication is far beyond it, and it has definite impact on the patient outcome. And this is what we are going to, learn from this program. And then I'm sure you'll be able to implement this when it comes to actually conducting training program. So that's my promise to you. I'll make sure that you get trained for that and you are able to take that home. Thank you so much. Thank you. So welcome, Renuka. I'm glad that you are able to join in a proper manner. And I'm really sorry for the confusion of that, two links got generated. I don't know how. I'll take care in future that does not happen.
Nice to meet you all. Thanks. Sorry, I wasn't able to join through the video last time. Good to see you all here.
Yeah. So would you like to share anything that you remember from the previous session and anything that you wish to clarify or make a mention before we start with this second part? Am I audible, Renuka?
Yeah, the last class, ma'am. The last class was on the transition communication. That's what I remember as the thing that we did, and how the handover and handoffs that we do is very, very critical, especially when it comes to clinical aspects. And sometimes due to the workload, there is a lot of mistakes happening, ma'am, that I'm seeing on a day-to-day basis. Let us see how to improve that at the ground level of working. That is what.
Definitely. So one request that I want to make to all of you is, I'm ready to share the recording, and I've shared also. I'll share the future recordings also. But let me also tell you, participation and listening to recording is hell lot of difference. That is one. And second is, here you are going to interact. If you have a question to ask, there are so many people to help you out with. If you will look at the recording, you may have a question, but still that will not get answered. And second thing is, at a stretch, sitting and watching 2 hours recording is not possible, because you require actually 2 hours, which is difficult. Otherwise, if you have a program, you would push everything to make sure that you are able to take time for it. But when it comes to watching recording, we know we can watch it anytime. So then there's a possibility we may not watch it at a stretch. So my humble request to all of you is, let's do it very, very seriously. Taking you there and making sure that you become wonderful trainers in your own place is my responsibility. I'm there with you. I have your back. Have that trust in me, but attend the program very, very seriously. That's what I really want from all of you. That's all. Rest is my responsibility. So going ahead with, I think, Poonam, I would like to have your opinion about the last class and anything that you expect in the future classes that you want to be addressed. Poonam, unmute yourself, unmute your device. Please, you mute,
Yeah. I would just like to tell you that it is the most neglected area in our public health sector, which people don't give importance at all to this. And we really have to work hard for all these things. First class was really a basic class. To build upon it, we will continue with the other sessions. And more of practical tips we require, how to handle different kind of situations and how to handle in a team. Team building is very important aspect in this, because we all are from different levels, like from doctors to nurses to attendants to helpers and all. Like how to build up team and through communication.
We will definitely bring that.
In the future sessions, we will be discussing these things.
Definitely, we will be bringing that up. And the last session I kept basic because I wanted everybody to be on the same page. So many of you may have found it very, very basic, that why are we doing this? But I'll tell you another reason why I did that program, and then you will understand the relevance. But after we have finished with Isha, so after we have Isha's feedback, then we start with this session. So Isha, if you could unmute your device and just share your thoughts. How did you find the last session? Anything that you wish to say about future session that you expect from us? That will be really nice. Yes, you're audible. Yes, Isha.
Good evening, ma'am. Good evening, everyone.
Very good evening.
I am so sorry. There's some network issue from my end. I'm struggling with it. Well, ma'am, I think all of us, all of them have already covered most of the point, the effective communication and the role of documentation as well. Well, if I connect with this, my field, when I also have to communicate while I'm in the session. So yes, I also understand how important it is to document everything.
Yeah.
And to expand to the field of health and communicate, I understand how important role it can play.
Yeah.
And yes, so we can take it forward from there.
Sure. So thank you so much, everyone, for giving me your feedback. And I'll make sure that whatever you are expecting, we integrate that in the program. So moving forward, uh, before that, I just want to say a couple of lines. Last session and this session that I am going to take, to some of you, this might appear a very, 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 very basic session. The purpose of doing these two sessions with all of you is, one, those of you who want to become trainer, trust me, these will be the two entry line sessions for any training program. Be it with doctors, be it with nurses, be it with front desk staff, be it with the support staff, even security staff. I'm not saying that you need to take 1 hour session with them or 2 hour session with them, explaining them what is the importance. But whenever you will start your session, if you will start from the basic and just ask them, why do we need to learn it? Because why gives them clarity, why do I need to learn it? So always start your session with this clarity, that why are we doing this? Why am I learning this? And in that, most important thing that you will have to emphasize, which I'm speaking on the basis of around 1,500 programs that I've done in the last 10 years. If you can show them what is in it for me, you can write this down. What is in it for me? So everything, if you're able to showcase how are you going to benefit by learning these skills, they will be with you. So when I do program for medical students, I help them see they're from a government hospital. So the government hospital scenario we all know is very different. So they feel, oh, all this we can't use with the kind of clientele we have in government setup. You're teaching us to behave well, to listen, to offer them seat, to smile. So when I tell them, don't look at it from the narrow vision of working in a government setup. This is now. 5 years, 10 years down the line, you will be in private practice. You will be in a corporate setup. You may be practicing even in Western countries. So you learn these skills with the idea that these are the basic skills you will require in any good setup. And this is like your playground. Hone your skills. So they immediately become, interested. Okay, yes, what she's talking makes sense. And I spend full day teaching them how do you conduct patient interview, which they don't know even ABC, because there is no formal training in that. And they thoroughly enjoy the training and they like it. So Isha has decided to come as an observer for this Thursday class, and you're more than welcome, Isha, to come and join me for the whole day, and you will get to see like how do you really go about helping the student first get engaged, and then also how do you transfer those skills to them. So anybody who can come to Delhi, who is willing to come, I have another, after this program, I still have around 5 programs to go. I'll be more than happy to have you as an observer in those programs, and because that will give you an opportunity for live sessions, how I am doing with the medical students. So you are more than welcome to join me. So the session that I'm going to cover today, again, for some of you, it might appear very, very basic, but this topic is very important from the point of view of organizers of training. See, when you will offer trainings, you have to actually not only fulfill the need of the attendee, but the objective is to fulfill the need of the organizer of the training. Because when what they want from you is, do something that my staff becomes better behaved, do something that they behave well with my patients, do something that they send my patients satisfied, and there are less fights and less arguments with the patient. So this session that I'm going to do with you, I normally start with this session after I have talked about importance of communication, maybe for 15 minutes or 20 minutes, depending upon the group I am addressing: doctors, nurses, paramedical staff, front desk staff, security staff. I've done around 16 programs for the security staff of All India Medical Institute. and support staff, cleaning staff. So you will get a lot of opportunities where you need to talk to them because they are the one who needs to learn how to handle or treat patients. So your clientele can be very varied. All this we are going to talk in the next session. How do you design a training program? I'm going to take a full session on that. We'll have a discussion around it. But today's session is all about the essential skills that you require in patient handling. And for the ease of your audience, I try to give them number. See, if you will give them number, it is easy for them to remember. I can give them 10, 20, 30 skills. But if you give them number, first, it will be easy for you to remember. Then it will be easy for you to transfer that. And it will be easy for them also to remember. So before we move forward to the 5 essential skills, let me share the screen with you. Much before that, I think I would like to share the link of a questionnaire. That's a questionnaire which is very, very, but 1 second. Very simple questionnaire, but that will give you an idea about how you can use this questionnaire with your clients. So this questionnaire I've already given you in the booklet. It is there with you. The questionnaire is there with you, but I'm going to share a Google link and you need to respond to this questionnaire. Give me 1 second to send you the link. Okay, I've shared the link to the form. You can all quickly start working on it, and it shouldn't take more than a couple of minutes.
Where have you shared it? In the
chat box, chat. Should I share in the WhatsApp also? But I think it should be easy for you to work right here. Not able to see? Okay, thank you.
Excuse me, ma'am.
Yes.
If you could share in on WhatsApp, finding difficult to open here.
Okay, I'll do that. Give me 1 second. So our group is master trainer. Okay. Okay, I've shared in the WhatsApp also.
Yeah.
Done, ma'am.
Okay. Those who you have done, you can write done in the chat box so that I know how many people are still left. Write done in the chat box. Yeah, I've received 4 responses. I think 5 people have submitted, 5 more to go. So this questionnaire is there in the content that I have shared with you. I would advise you to use this questionnaire as one of the preliminary, questionnaire when you start with the program. I think Dr. Hemant, you have some challenge at your end. There is some electricity failure.
Probably, ma'am, because Indore is very frequently, there are electricity failures. He may get online shortly, maybe through his cell phone.
I hope so, yeah. So,
ma'am, a question on the questionnaire. So this is mostly for the doctors and those who consult with the patient.
Modified. Beauty.
Yeah.
Modified.
So how about people who are completely non-clinical nurses?
I am giving you a template. So whatever your training needs are, whatever your observation is, put them as a question mark in this.
Okay.
So as a result, you can tweak it. What I'm trying to give you is some basic content. You can use it and modify as per your requirement. But when you give them this questionnaire, the benefit is they get grounded. They get grounded because you will see most of the people do not even follow these basic courtesies to the patients. Do you agree with me? Especially in a government sector. In a private sector,
totally.
if they are doing it with the resistance, not like very happy. Am I right?
Yes.
So I would always advise you to do this questionnaire first so that they get grounded. So Dr. Samira, what is your take on it? Because I want to understand your understanding of this questionnaire and how useful do you find it?
It is really useful. It may make the person to assessment whether he is using communication skills or not.
Yeah. So usually when you will do it on Google Form, you can even show them simultaneously the responses. And the responses are visible in the form of graphs and pie diagram and charts. So it gives a clear visual to them what we are doing good. There's a possibility 80-90% of them will say, oh, we are doing it exactly in this manner. No, the one line that instruction that I always tell them, please write yes if you are doing it for more than 80 or 90% of the patients, and write no if you're doing it less than 80-90% patients. So once you give them this one line of instruction, they will not say yes, because we have a tendency to give socially accepted response. So it's good to always give them one line of instruction, that please don't give yes just because you have to say yes. We are not asking for your name. We don't know who is answering this, but this is an honest answer that you need to give to yourself. Even if they say yes to everything, yes, I am perfect at it, then maybe it is time to congratulate them. Tell them, wonderful. If all of you are already doing it, that's something very, very nice. I'm sure your patient must be going very happy and satisfied with you. So you can use this tool for both the things. But it's always good to use this tool to, ground them, so that they get to see I'm not even following the basic, courtesies that I need to offer to my patient. Okay. So from here, I move on to the slides that I want to discuss with you and tell you the 5 basic skills that I think any healthcare professional, again, with whom we interact, it will be different. For example, if I'm taking a session for doctors, I'll change these skills. If I'm taking this session for nurses, I'll change a set of skills here and there. But more or less, the boundary will be same. The skill set will be similar to each other. So can you guess these 5 essential skills that you think they make a great foundation for a wonderful healthcare provider and patient communication or relationship? Can you guess? Write in the chat box 5 essential skills that you think would make a wonderful foundation for your provider-patient relationship. Write in the chat box. Okay, listening, very good, very good. Listening. Empathy, very good, excellent. Empathy, being compassionate, very good. Team building, okay. Caring, beauty, okay. Patience, okay. Empathy, active listening, questioning technique, very good. Gurleen, lot of questions, a lot of ideas you have given, excellent. Active listening, full attention, very good. Positive body language, great, great. So if the patient enters your vision, patient is right in front of you, what 5 skills can make sure that your patient goes back very, very happy? Exploration of patient's concern, very good. Being present with the patient. Eye contact, wonderful. Attentive listening. Just 1 second, I think Dr. Hemant has joined us. Okay, mindfulness, wonderful. So very good answers, excellent. So Dr. Hemant. I thought you lost your network connection, Dr. Hemant, I think. So we have just started discussing the 5 essential skills for patient.
Sorry, ma'am, some network issues, so due to Wi-Fi issues. Yes, yeah. I'm back. Thank you.
Yeah, so I could understand, probably there was electricity failure or what. So it's all right. So I hope you are comfortable now. Okay. So as I said, these 5 essential skills, if you can keep, you can tell your participants to have them in their pocket all the time. Trust me, it will bring a drastic change in the performance. I have done this at number of hospitals where the hospitals hired me to do something with the staff because they are not courteous, they are not attentive, they are not polite with the patient, they don't address patient's concern. I clubbed everything and put them in 5, and right from the next day I received a wonderful response of this session with the participant. So what are these 5 skills? Let's understand this so that you can use them in your training program. This questionnaire we have done, I'll show you the result in a while because I want to first finish the discussion about it. The first skill that you require is prompt attention. The moment a person comes in the visual field, I think whether I'm a doctor or a nurse or a front desk staff, lab technician, radiographer, and whoever I am, first thing that I need to do is, can you please mute your device? I think somebody's device is. Thank you. Thank you. It was making little sound. Yeah. So the first thing that you have to emphasize on is prompt attention. Now, how do we give prompt attention? How do we give prompt attention?
Making eye contact.
Making eye contact. So normally what happens, for example, I'm a security staff or I'm a front desk staff. Okay, I'm a front desk staff. So what happens if a patient comes or patient's attendant comes and stands in front of me? Usually, what do we observe?
Usually what what we observe is that the person who's on the front desk is more busy doing his or her own work, doesn't look at the patient, and while looking down or looking towards their own colleagues, they ask questions. So it is a feeling for the patient or the patient relative that they are not welcomed
Exactly
in that organization. So
exactly.
the very first impression is a very negative impression.
Exactly. Many a times, actually, the staff may be really, really busy doing something. Actually, genuinely busy doing something. But even then, if there's a person right in front of me and if I'm not making eye contact, what can be the misunderstanding? What do you think can be the misunderstanding?
That they are not welcomed. I think that's the message they are sharing.
Exactly.
Interested.
Exactly.
Not
And I
giving
think that's the
respect,
usual.
not giving respect.
Not being
Respectful or
not being that we don't care for them. I mean, you are
Not attentive towards the other person.
Yeah, I don't care for you. I think that's the
I
communication
don't.
that goes. Yeah. Okay. So I think, yeah, somebody wants
ma'am, it can be like it's a granted kind of feeling where you are like another person who is walking in. So not giving that individual identity that
you are no special for me. No, you are no
special
special.
for me.
And you will have to wait. I'm very
Right,
busy.
right.
I have some important work going on. You are not as important as the work that I have in my hand.
Yes.
So this is how sometimes unknowingly we communicate that we do not even know what is being communicated. So I think one thing that we have to really help them understand the importance of prompt attention. So what I tell my students, what will happen if you see your patients walking into your room? What will happen? How will that benefit you? Can you can I request all to keep the device on mute mode, and when you're answering you can unmute and then you can mute once again. Thank you so much. So anybody who would like to answer. So what do you think if you want to emphasize to the medical student, what is the benefit of giving prompt attention? Because usually there you will see they will be busy doing something and they will not look at the patient.
Ma'am, what I feel and generally your good work is and building rapport. The moment the patient enters your fraternity is very important, because your good work is not for your good times. What I felt in for the experience, it's always for the bad times or the inconveniences caused. So if you build up a rapport from the moment the patient have entered, and that person, because he is there in your setup for as an inpatient, it may for longer time. So and for OPD for shorter time. But mistakes can happen not from only from your end, but your whole team. Anyone can happen. But if you have taken the lead and being proactive, so patient is quite a bit large-hearted, most of the people, and they forgive and then move on. So that is one thing.
You're talking about the benefits. Wonderful.
Benefit.
So you're talking about the benefits of prompt attention. I think we'll come to that slightly later, because I completely agree with what you're saying, that attention would actually communicate that I am well behaved, I'm courteous, you are welcome, and I'm happy to help you. So this small one gesture, which sometimes we don't even realize how important it can be, it can actually be a good work for the bad time. You're very right, Dr. Hemant, because if I have been able to showcase that I am happy to help you and you are welcome, most of the times, even if there is some confusion later on, they are likely to forgive and forget. But what happens when right in the beginning, we don't give them any attention, patient feels not being attended. Patients feel that they are not wanted or they are not welcome. So how do you really make sure that you give prompt attention? I think one of you said making eye contact. What else? What else?
Introducing yourself and then asking them for their introduction.
Exactly.
Ma'am,
A simple, a simple smile.
Patient comes with generally pain. So by seeing their degree of whether they want to sit, want to lie down or something, so their thing of comfort is most importantly needed.
So true. I think you're very right. Attending to their physical comfort. For example, if they're in pain and they are standing in front of me and I'm continuing to talk, they're really in stress already. On the contrary, if I can observe that this patient has come with discomfort, and I say, please sit down, I'll help you. Sit down, I'll come and talk to you. Or you ask somebody to go and talk to that patient. I mean, how different the patient's experience will be. So similarly, even if the patient has come to the doctor's chamber, if the doctor can make sure that the patient first becomes physically comfortable and then starts, talking about the problem, patient is definitely going to feel better. So I think one thing that we have to help everybody, be it doctor, nurses, or anybody, that first thing the patient wants is prompt attention. The moment you give them that attention, they feel welcomed. And even if you make them wait for a second, for example, I'm attending a phone call and the patient comes in front of me and I say, sir, please wait a minute, let me finish this call. Or I'm attending a call and I put this call on a hold and say, sir, just a second. And then I tell, sir, it's something important I need to finish. Let me finish this. You take your seat. I'll come to you and talk to you. That means you are, first of all, acknowledging that person's existence in front of you. When you don't make eye contact, you are in a way communicating that you don't exist. You are not in my visual field. And that's where the actual friction, starts happening between us and the patient. And then demonstrate interest and respect. So when the patient is talking and I am, not paying attention, or I'm simultaneously doing something that shows I am not interested in listening, or I'm not being respectful. So I think these are a couple of the things I think anybody who in the healthcare should remember when patient has come with pain, with suffering, what they're looking for. Please help me. Please attend me. Please provide me the care that you can provide. Second thing that you have to emphasize on is building rapport. So my first question to all of you, I want others to speak, those who are not speaking. What do we mean by building rapport? What exactly do we mean by building rapport?
Establishing a line of connection.
Okay, very good.
Actually, hospital is one place where no one comes casually it's not a mall. Yeah. I mean, people bring in illness and pains and discomfort.
Yeah.
And if there you get someone to speak nicely to you, to be empathetic, I mean, nothing like it.
So true. So is building rapport difficult?
It's very subjective.
Is it?
It's very subjective.
Yeah, Dr. Hemant, you wanted to do something?
Yes, ma'am. Yeah. We have to be very smart enough, because
my question is it difficult or easy?
If you do over the time and again, it's not much difficult. It's a practicing art. You have to practice it.
So let's do a small activity. I'm going to put all of you in, breakout rooms. So you will be in pair. And I will be giving you a prompt to discuss between you. Whatever you are doing today, if you were not doing this, what other thing you would have been doing? You may be a doctor, a nurse, or an administrator, or a trainer, or whatever you are. If not this, where you would have been? That's the prompt you have to discuss. The total time that you have is 4 minutes. So first 2 minutes, one person will speak, the other will listen. And in case if you want to clarify something, you can ask and clarify. Then after 2 minutes, the other person who was listening would speak, and the person who was speaking would listen. Let's come back after the breakout room and we'll have the discussion person. Let me quickly make the breakout room. So we'll be making 5 breakout rooms, and it will be at random. So I am not, choosing anybody to be with anybody. It's just random. Okay, so you are moving to and after 4 minutes, I mean, you will have to come out, because I have not been able to time it. Okay.
We're back.
So very quick to finish your introduction with each other.
Yeah,
Yes, we shared enough information.
Yes, and I got to learn something very interesting. Sorry, I'm so excited. I'm cutting you off. I got to learn something very excited that Kurdish and in Hindi, I mean, both languages have many words which are very similar. Like the numbers also, ek, do, teen, char. It's the same in Kurdish. That's what Dr. Samira told me. Very excited.
So if I ask you to write in one word, what was your experience? Write in the chat box, just one word.
Experience about the whole, what happened, or about the person?
This interaction, how did you feel about this interaction?
Sorry to interrupt, ma'am. Is this going live on YouTube?
Yeah.
You're recording? Okay.
Yeah.
On YouTube.
You maybe you joined later. I had taken permission from everybody.
Okay, okay.
No,
I'm just seeing that now, so I was like,
it is not going live on YouTube. It is in the private this thing. I'll be sharing the link with you so that you
okay,
can.
Okay, fine. Sorry, I didn't want your class to become visible to everyone. So I was
all right. So good. But this is for everybody's convenience. I'm uploading so that you can all have a look at it after that.
Right.
So write in one word in the chat box. What has been your experience of this activity that we did together? So amazing and quick rapport establishment. Wonderful. Rapport building with my teammates. Excellent. So easy. Okay. By introducing oneself and clarifying. Interesting. Wonderful. Wonderful. Four minutes can change the world. So true. So true. So true. You know, I was taking the same activity in one of the hospitals. Incidentally, the head of the department of anesthesia happened to sit with the nurse who is working in his department. He said, I've known this girl for so many years. I never got a chance to sit like this and ever talk to her in this manner. And actually, this is what happens, you know, we work with people, but we are so formal and so, you know, caged in our own self. We don't break that cage. And how easy it is to be. And how well connected you start feeling with people. Similarly, building rapport with patient is not at all difficult. With building rapport with your team is not at all difficult. Only thing is there has to be a desire to connect. Do I want to connect with this person? When you think, yes, it's important. See, you got to highlight this to your audience. Can I request all of you to mute your device? Sorry, this. I know it's kitchen time. And one announcement that I want to make here, in case if you want to have a cup of tea or coffee or soup, or if you want to eat anything, please feel free to eat. Absolutely no problem. I know it's dinner time, so you all must be really tired and hungry. Feel comfortable to eat or drink anything. We are all adults and we can, you know, handle that. So you can actually help your, you know, team audience understand. See, you spend most of your productive hours in your workplace, and that's like your second home. People with whom you work is like your second family. We normally value the time and the interaction at home, but we do not value the people working in our workplace. Rather, they are the one, if you have good rapport with, you can go back happy, satisfied. You don't carry just money from your workplace. You carry energy with you. So it's very important to create positive energy. And building rapport is one of the best ways to create positive energy in any workplace. Even if somebody is upset, if you are able to just talk up for a second, things can change for that person. So in patient handling, building rapport plays a very big role. The second thing that they have to always remember is building rapport. And most of the times you will get the answer when you ask them, is it easy or difficult? They'll say it's very difficult. If you ask them how much time it will take, they'll say 5 minutes, 10 minutes. Actually not. Building rapport does not require time. Building rapport just requires intention to build rapport. So building rapport is not about about time. It is about desire and also the intention. And why do we need to build rapport? Normally we think patient wants it. No, even we need to build rapport, because ultimately I may have to communicate something very difficult for the patient. I may have to ask very sensitive questions like about the sexual history of the patient, or if it is a rape abuse case, then I need to take details of the rape, or in case if it's a patient who has suicidal tendencies, I need to talk about the suicide or some domestic violence. So these are the things, it's not easy as a healthcare provider for me also to ask. So building rapport is not just for the patient, it is for both the parties. Therefore, it is very important. Then how do you build rapport? I think make them do this activity and they will immediately be your fan. Oh, it was so easy to build rapport. So building rapport does not take time. It just requires your intention. And one clarification here, very often, especially doctors, they feel building rapport means becoming friends with the patient. So you need to ask this question, is it making friendship? So my question to you is it making friendship? Is it making friendship?
No.
It is not.
No. It's not. Shall I?
Yeah.
Just again, when communication is considered as niceties, that one misconception. So same is building rapport is considered being friendly with the patient, over friendly with the patient.
Yeah.
But it's not like, it's like giving trust to a person who has come in pain to your institution, whether he will be the highest paid or politically well connected, whatever it is. But at the moment he has come, and even one line, what I have been my experience, and say he has got certain complaints like miscellaneous things. And if you say, if nothing works out and you have got lots of issues, something, there will be one person, me, myself, who will be always there to stand for your needs. And that line itself gives a lot of confidence. Ki, okay, at least there is one person whom I can go and say, who is ready to listen. And it's not about, I have also, ma'am, one thing, people say good thing on the face to be smile and happy. But in healthcare, it doesn't matter only speaking. You have to walk the talk. If you have promised them, ki, okay, you have to, like, if a person is needy and somehow you have get in. So you have to walk the talk, meet the person concerned, meet the concerned doctors, resolve, try to resolve their issues, present their issues in front of them. So the patient will then only gain. Otherwise, if you say on the front desk with a good smile and something, and okay, we are there, and you don't walk a talk, you don't, ma'am, it will just vapor away.
So what I'm trying to say here, building rapport is not becoming friends. There's a difference between being friendly and being friend. Whether you are on front desk, or you're a doctor, or you're a nurse, or a pharmacist, lab, you are being friendly because you want to be kind, compassionate, helpful, but you are not friend. There we draw a line that I am not going to talk about any unprofessional thing. We don't talk. And even if the patient tries, we assert. So we're going to talk at length about assertion, because that is one communication skill every healthcare provider must learn. And we'll talk at length about that communication skill. How do you identify what is my communication style, and then how do I work on my communication style, that we are going to do in the coming session. But very clearly you need to help them understand that when you are building rapport, the idea is not to become friends. We are not going to talk about clothes or jewelry or where do you live, are you married, how many kids you have. No. But the comfort that we need to give to our patient is that I'm there to help you. So this is the second skill that I think we need to emphasize on. And also, good thing that you have to tell them is that building rapport happens in just 1 minute. So the concept of golden first minute, I think in the first minute itself, you would know how far I have been able to build rapport with my patient. And if you miss that chance, you have missed a golden opportunity. So make it very clear to them, do not miss this opportunity. And in the first 1 minute, your impression on the patient is almost made already. So to undo and make a better impression will be another challenge. So it's always good to create good impression right in the beginning. So again, most of the things are saying, greet the patient, smile if appropriate, introduce yourself, ask for patient introduction, small talk before the big talk. So when we say small talk before the big talk, again, it is to make your patient comfortable and open up. For example, if you say, have you been waiting for very long? Or where do you live? Or who is this with you? This is just a small talk that you will do, but that will open up a dialogue between you and your patient. So this is another skill that you really, really need to have in your pocket. Now, guess what is the third skill? Can somebody guess?
Listening.
Wow, very close, very close. Okay, but before that, I want to show you a video. So this video is, my in-house video. So maybe qualitatively, you may not find it very, very, professional. And also, I'm not sure, Dr. Samira, if you will be able to understand Hindi, because we recorded it in Hindi thinking that we are doing it for the Indian audience. I didn't know I will have international audience with me. But this video has, interesting, aspect to show. In this, my husband, who's an ophthalmologist, he has acted as a doctor. You will see the video, and I have played another role. So let me show you the video, and then we have a discussion around it. So please do pardon me for the quality of the video, but the message is very, very clear. I'm sure you will like the message. Let me quickly show you the video. Okay.
क्या तकलीफ है? आँख में दर्द है। कब से है? कल रात से। और क्या होता है? थोड़ा बहुत पानी भी निकलता है और थोड़ी रेडनेस है। कब से हो रहा है गाली? गाली मैंने आज सुबह दी। ये दवाई करो तो 3 बार सुबह दोपहर शाम 5 दिन के लिए।
So what did you observe in this video?
The clinician did not even once look at the patient. There was no acknowledgement of the presence of the patient. His tone was quite monotonous, as if like it's just something he has to ask the questions and he's doing it. The patient was continuously looking at the doctor, expecting that I will get some kind of a similar kind of a feedback from him, or at least he will look.
Comforting word.
Or at least the doctor will look when she's saying that she has pain, redness in her eyes. At least he'll look once, and the way he looked at her, I don't think so any patient would have gone satisfied.
Exactly. Now you see, he had 1 minute time. In that 1 minute, even if you are attending for a minute, you could make the whole experience very, very different. Very, very different. So let
me add, ma'am.
Yes, please.
Ma'am, let me add. Yeah. The beauty of the thing is that sir is exactly opposite. Sir is so humble and so soft spoken, and so that's how for him to act in a way itself would have taken a long.
So he did this for me. Yes. Dr. Samira, that's my husband. Dr. Samira, that's my husband. He's an ophthalmologist, so I made him do that role for me because I wanted to record. So one more thing that I want to tell to all of you is, do not hesitate making your own videos. I didn't take any technical help. It was COVID time, and I was developing an online program, and I wanted some videos for that. I called all my staff, and we all shot this video right in my clinic. Bindu has seen my clinic, and Poonam has seen my clinic. I think both of them have seen my clinic. So in my own clinic, I just asked my husband to play that role for me, and I asked my staff to act as patient. So this should inspire you that even you can consider doing such videos according to your requirement. Maybe if you want to show the front desk staff misbehaving or not being courteous, that gives a golden opportunity for them to reflect. Yes, Dr. Sampana, please. Unmute your device.
I have done many such videos, ma'am, wherein actually I am acting either as a patient or as a doctor or as a clinician or maybe as a nurse.
I'm sure you're very innovative.
I've done a lot of mock drills also being a patient, where people have taken me in, lifting me up in the code blue. So it makes a lot of difference, ma'am, because then people remember this, and it affects them quite positively, ma'am.
Yeah. So all of you should think of making your own videos to suit your requirement. So let me show you another video now. Could he have done it differently? But I'm sorry, the next role is played by me and not him. So don't think that I'm trying to show him in the bad light. I'm really sorry. That is what I communicate. Is it? Not yet.
हाँ जी आइए क्या नाम है आपका वेरी गुड क्या मतलब होता है विद्या का means someone who is well educated. So you are? I don't think so. Very good fight. That's nice. Very nice name. I never heard this name earlier. Very nice. So who named you? Your mom? My mom. Oh, very nice. Okay, tell me Rita. क्या तकलीफ है कैसे आना हुआ मेरी आँख पे कल रात से बहुत ज्यादा दर्द है राइट and आज सुबह when I woke up I noticed that there's some water coming out. It's also looking a bit red. I think when I saw it in the mirror I saw it. And just very strained. I'm not being able to see properly.
So what is the observation?
A warm doctor.
Yeah, very
Human touch
welcoming.
was there. The earlier video was very robotic. There was no human touch.
Yeah.
And here it's all human, and I mean the patient would like to have ear problems again and again.
Any other observation about this video?
It was very welcoming. So the patient spoke more than the doctor did in the second part when the discussion actually started. So that's
and the
important.
duration was more or less same. That was 40. Yeah. This was 1 minute. That's all. Any other observation?
The comfort was offered. The comfort was offered by the clinician, and so
proactively, we as healthcare providers have to facilitate that. Patient will not know how to really build rapport with us, but we need to proactively do that. Yeah,
exactly. The clinician tried to
encourage the patient to speak out. No?
Yeah, wonderful. Dr. Santwana, you were saying something.
Yeah, I said the clinician tried to break the ice by just starting a normal conversation, which was a bit of informal conversation, and then get to the topic. So this really helped the patient with giving a better understanding about what exactly the issue is. And at the same time, it is more of a psychological relief also, that fine, I'm in safe hands and I'll be taken care of.
Very good. Any other observation that I want to point out, if anybody can?
Simple thing like turning towards the patient and making that contact. No, Pele doctor was just writing.
Facing the patient.
Facing the patient.
I think
the patient and
I think patient was
that circle is completed. Yeah.
Really satisfied after going from the patient becomes satisfied.
So naturally, that's the aim of our practice. One observation that I want to make you, and I want to remember when you are, especially when you're working with the doctors and people who are into patient interviewing, the first question you ask, if the first question is, kya takleef hai? Kya problem hai? What is the problem? And if instead of this, if you ask, हाँ जी बताइए, क्या किस लिए आना हुआ? You will get a very different story. The first question is, what is the problem? So patient will only talk about problem. I have redness, I have watering of eye, I have headache, I have strain. If I say, tell me please, why are you here? How can I help you? Doctor sahab, 3 दिन से मेरी आँख में दर्द हो रहा है, पानी आ रहा है, जलन हो रही है. You will get bigger story. When you get more story, you will have more information. You will be able to make accurate diagnosis. So usually when we are teaching patient interview, we tell them to start with an open-ended question.
Ma'am, shall I?
Please.
Here comes the corporate set of the things. So what happens ki generally the clinicians generally most of the time they doesn't want a bigger story. So they want like the patient can come and straight away on the point what he has and he could write and then patient go. Now the matter of fact is, ma'am, the patient get appointment and there are many other patients before that patient. So patient expects value of time. So if he has or she has been waiting for 15 to 30 minutes on an average time, so when he goes inside and he has paid a fee of some 1,000 rupees, so he doesn't want that he goes and he's out in 15 seconds.
Yes.
So you know that as a clinician, the problem is only of 15 seconds, 10 seconds. But as he has waited for 30 minutes for you and paid the fee, so he expects that 1 minute of yours, 60 seconds of yours in that cabin, in that room. So to give that 1 minute also is essential, ma'am. This is
so true. So true. And usually we have this challenge patient coming out and saying that I was not attended, properly. I was not heard. I was not allowed to narrate my problem. And Dr. Hemant, the problem is not just in the corporate sector, in the government sector as well as in the government. Give me 1 second. Let me complete. I'll come to you. So in the government setup, normally they say we are short of time and therefore we don't let the patient speak. In the corporate sector, they have this attitude, I know everything, you don't have to tell me everything. So that means the thing is, we being trainers, we have to ensure that they understand why it is important to listen to your patient. So maybe I will have to bring in some studies and tell them, studies suggest 50% of the diagnosis can be made if you ask open-ended question and allow your patient to talk about their problem. So then they will understand, okay. Then if you also highlight listening is therapeutic, if you allow the patient to talk about their problem, their emotions get vented. And when they're able to talk about that problem, even the burden of the emotion becomes lighter. And when you lend them an ear, they feel satisfied. Their satisfaction multiplies. Then there are studies. See why I'm saying this? Just saying will not help. You will have to have studies to showcase that you are carrying a bag of knowledge at your back. Then they will understand and agree with you. Also, there are studies when the practice is doctor-centered practice. It is 7 minutes and 45 seconds. This content is there in your booklet. Almost all my presentations content is in your booklet. You can make n number of PPTs from that. So one of the studies says, if you have doctor-centered approach where you will decide what to talk, what to say, what not to say, you will spend 7 minutes and 45 seconds. But if you allow the patient to ask questions, if you address patient's concern, any idea how much time more you will spend? Your audience,
just a few seconds more.
Your audience will say 10 minutes, 15 minutes. And then you say just 45 seconds more. Of course, that comes with skill, because patient would talk. Normally, then the logic, they will say, ma'am, you have no idea. Old patients talk a lot. If you allow them to speak, they would talk anything. There you have to tell them, yes, they would talk things that are not relevant, because we are trained doctors. They are not trained patients. So there you have to say, you will have to bring the patient back to the point. But again, it depends, how will you bring your patient back? If you say something like this, then I ask my doctors, okay, if the patient talks something irrelevant, what do you say? Dr. Samira, do you know what do they say? In government setup,
we should redirect the patient, but in a polite
manner.
way.
But I asked a group of doctors working in government setup, how do you bring the patient back? You know what do they say? They say, don't talk bullshit. I'm not here to listen to all that bull crap. Talk to me to the point. Or you're not going to speak anything, answer what I ask you. Because in government setup, this is what they feel, that they are more, in position, they are higher in hierarchy. So then I help them understand, if you interrupt like this, if you insult them like this, one is patient will close down. Second is patient's attendant who is overhearing this conversation. He's most likely the son or the grandson of that elderly patient. He is going to be very angry with you. Given a chance, he'll hit you back. Because you are in a safe place, he will not touch you. But the moment he will see you out, he's going to bash you. Then they realize, oh yes, we do this mistake. So what I'm trying to say, whatever they come up with, we have to hold on the discussion. We have to help them understand why listening to your patient is important. Sorry, Poonam, you were saying something. I had to.
Yeah, I had the same thing.
Yeah.
Difference between private sector or corporate or government sector.
Everywhere
they have the same doctors and the same culture they have. Exactly. In the government sector also.
I completely agree with you. I completely agree with you. So moving further, so I think we have some idea now what is the benefit of prompt attention and building rapport. It doesn't take extra time, but then it really, really changes your quality of interaction with your patient. As very rightly said by some of you, third skill that they have to acquire is listening attentively. And how important is listening? Let's do another activity and understand. I think activities help us more to, to see. So what I'm going to do, I am going to first, how do I do? I want to send 5 of you to the waiting area. Okay, so I'll send 5 of you to the waiting area. I'm not picking anybody who is in the order, I'm sending you there. So Bindu, you are going to the waiting area. Okay. And then Dr. Santwana, you are also going to the waiting area 2. Beauty, you are going to the waiting area 3. Isha, you are going to the waiting area. And one more person, that is Gurleen. Okay. Put in the waiting area. So 5 of them are in the waiting area. So we are now, we are now 6 of us, excluding me, you are 5. So the task is, you have to be ready with some interesting experience that you had to share with them. Are you getting my point? Something that some experience that you had in past, which was very, very interesting. So you will have
about
anything. It could be personal, it could be professional, anything. Something very, very interesting that you have on your mind. And it's a beautiful memory and you feel like sharing with your, a partner. So give me 5 minutes, not 5 minutes, 2 minutes to talk to them, and then I get back to you. So meanwhile, you can start thinking about anything that you want to talk to your partner about. So give me a second to speak to the, okay.
What is the meaning of Heman in Indian language?
Yes. The meaning of Hemant. First, I would like to share one more thing. My date of birth is in Feb month. So during the Feb, it's a winter season here, and which is considered very beautiful. Basant Ritu in Hindi it is said, most nice season of the year. And in that they have got three components. That is Sharad, Shishir, and Hemant. And the Hemant is the most beautiful of it, very pleasant. And as I was born in that period, so it's now named Hemant. So that is the meaning of Hemant.
Wonderful. We have same word in Kurdish. Heman mean quiet, and calm. Yes. And in our number, Kurdish and Indian number are same. Ek, do, se, char, pinch, same. So maybe our language from same source.
Great to know. And today also, from today onwards, I can add the meaning which says patience and calm. So generally said, I have got tons of it, and I have acquired that. So it will go well with my name's meaning in Kurdish, as you said, Dr. Samira.
Yes.
And let me share you, your name itself has an Indian connotation to it. The Samir is known as the air. The vibrance goes with it. So the word adding A to it, Samira, is related with air we breathe and this thing. So.
Thank you. But my name is an Arabic name, not Kurdish, because in Iraq we are two races, Arab and Kurdish. So in Kurdish language, no meaning for Samira, no such word. Yes, but we have many shared words with India. For example, Hamisha. Hamisha means always in Kurdish. In Indian same. Dil my heart. يعني in Kurdish يعني dil يعني heart. It means heart.
So what does it actually what is the meaning of your name? So in Arabic.
In Arabic,
so
close friend.
Oh great. So it's always to know, and there are times when I have interacted and people have not known the meaning of their names as well. At times it's just random. So while even giving a name to someone with whom the person is going to carry it all his life, we should giving it a thought.
Yes.
Not like that whatever we see around and finding good listening and we just name them.
Yes.
But we should have some meaning attached to that person or something which and
Yes.
if it matches qualities, then it's icing on the cake. So
Exactly.
it's great to know.
Thank you.
Dr.
And also Rinoka, we have in Kurdish Ronak يعني means light. It's a popular name, Ronak. Yes. And Punam, we actually don't have this name in Kurdish.
But you know moon?
Yes, moon, Haif.
The full moon is Poonam.
Yes, very
it's
nice.
Called Poonam ka Chand.
Yes, nice.
Like you call it Eid ka Chand is very little bit. And Poonam is full moon, meaning of Poonam.
Very nice to know that.
Okay.
Full moon.
Right. So, one second, sorry. Those who are in waiting area, I had given a set of instruction. Did you get to read it? All of you? And are you clear about it? Everybody's clear about it? Okay. So now I'm going to make a breakout room and send you with a partner. Give me 1 second. Okay.
Ma'am, I did not read the instruction. Can you please?
Okay, give me a second. Let me. Who did not get to see the instruction?
Ma'am, Isha this side.
Acha, Isha, you did not get to see. Give me 1 second. Let me try. Bindu, can you message this directly to Isha? Whatever you had read. Can you do this for me? Meanwhile, I'll make the breakout room. That will save us time. Unmute your device.
I'll check her number from the WhatsApp group and do so.
No. You right here in the chat box. You can directly go.
Okay, I would do that.
Please do.
I have to convey to Isha.
Isha. That's right. Yeah.
Okay.
So I hope now you are going to be with the partner who was in the waiting area. I'm hoping. So you have to join your partner, join your room.
I have to apologize to Hemanji. I was bad. I'm so sorry.
Samaira madam, I'm extremely sorry.
Never mind.
I'm the culprit.
Ma'am, you made me a person which I am never in my life.
I had to try so hard not to listen and not nod my head away, looking here and there.
It's only my acting skills that could help me, ma'am. But Samira ma'am, I'm extremely sorry. I'm extremely sorry.
I know. So
no, I understand you.
Even I tried my best, but failed. Talking to someone for the first time and giving such a cold shoulder.
So those who were speaking, what was your frame of mind at that time when I asked you to think of a very pleasant moment, very pleasant memory? How
Yes.
were you? What state were you in? Dr. Samira, please.
I feel that she is very, very anxious and very unhappy because she is in one room with me. I feel that she needs to be another one, not me.
Oh my
That's why
goodness.
I asked her, you are unwell, you feel something not good. She said, no, I am well.
I'm extremely sorry, extremely sorry. But when you tried explaining your story, what did you feel? What did you see?
No, then I remember that she is portraying the role of not listening. So I laughed. She said, "Why you are laughing?"
What about others? What about others who tried talking about something?
But we had a different experience.
Sorry, Isha, but you were saying something, please.
We had a different experience. I think Mayuri lost the network connection, and she did not listen to the instruction what she had to. And we were waiting for each other to really talk and say so that I can really react that I'm not listening.
But I'm really very sorry for that.
It's all right. Technology is something that is not in anybody's control. So that's perfectly all right. That's
all. We had a different experience altogether.
So this activity was given to give you an idea how does patient feel when they have to say something and we don't listen. So even sometimes when we are not able to help them, but if we are able to give them an ear, yes, I'm listening to you. I want to listen to you. I want to listen to your story. Even that gives them happiness and satisfaction. You know, in his book, In Search of a Man, Victor Franklin, he narrated his experience. Somebody's device is on mute mode. Can you put it on mute mode? Thank you. Thank you. So Victor Franklin, in his book, I think In Search of Man or In Search of a Truth, he wrote in that book that one day he received a call. He's a psychiatrist. He was a psychiatrist. He wrote in that book that one day in the middle of night, he received a phone call from a patient who said, I'm feeling suicidal and I'm going to kill myself. He was miles away. He didn't know how to, stop that. He knew he can't reach there. What he thought was he just kept talking to her. He engaged her in conversation, made her speak about whatever she had on her mind. And then when it was slight daylight, she said, Doctor, I'm much better. You can keep the phone. Then when she came to his clinic, she asked him, what did I do that stopped you from killing yourself? She said, the way you were listening to me, that gave me happiness and satisfaction. There is somebody who is ready to listen to my story and empathize with me. Listening is one of the greatest quality. Dr. Samira, in India, we have an organization called Saheli. People like you and me, they volunteer there. People who are distressed, they would call. These people don't give any solution. They don't provide any counseling. They just listen to them and just say, I understand. I can understand what you're going through. I'm sure I can understand your pain. And that does miracle. So listening is one of the greatest virtues. And I think this is something we really need to bring in our way of handling patients. So attentive listening is something that we really need to bring in our.
Can I say something?
Sure, please.
I had almost a similar case, I think few days back, when my client sent me a message, Isha, I want to talk to you. Can I? I said, because I know that she has a suicidal tendency.
Yeah.
I said, yes, you can. And then I spoke to her and then she was talking, she was telling what exactly has been there. And after a point, she said, Isha, much better. I think now we can continue in the session.
Yeah.
And now I am not feeling suicidal, and I promise I am not going to do anything.
So true. So true. Good that you could help her on time. Therefore, normally, whenever I get a crisis call from any of my client, I never say them no. Even if I'm hard pressed for time, I have this fear that if I don't help her now, you never know what would happen at the end. So it's
Yeah,
very
then you
important
would not.
with counseling.
Yeah.
You got to really judge and see if you think that it is an urgent this thing, we can postpone anything else, but this should be given priority over everything. Yeah, Dr.
Ma'am,
Shubha.
yeah, ma'am, I would like to add on it.
Yeah.
Generally, we have got a feeling ki who is heading this institution or who is in charge of this thing. So, will most of the people will listen a common question, यहाँ का in charge कौन है and who is head of this, and common question. So, when there are a lot of issues, and even we make our bosses understand, just meet once. You don't give them solution. Rest things will manage. But that thing, the family has come ki okay, they have met, and the director of the institute or the superintendent of the hospital, and he has listened to them. He has listened to their problems, and they will go back. They won't give instant solution, but
very good example.
coming daily and not meeting. So just meet them, and then we can work out. So that is how it works out.
So true, so true. Wonderful. Excellent. So similarly, I think if you see, there are multiple types of listeners. There are people who will just pretend they are listening, but actually they are not listening. And let me tell you, anybody can make out when you are pretending and you're not listening. There are people who don't care to listen. Right on their face, it is visible that they are not listening and they don't care. They will not make eye contact. They will not look at you. They'll continue doing what they're doing. And that's very, very insulting and offending to anybody. And there are people who are in hurry to answer because they think this is what you are asking and let me answer you. There are very few people who actually listen. So I think listening is something that we really need to not only listen, but also demonstrate that I am listening to you. That's the beauty that you have to demonstrate. So how do we demonstrate? Let me quickly give you a few tips which you can share with your audience when you are, conducting program for them. First of all, they must face the person. Second, make adequate eye contact. Whenever, even if you are writing some notes on the laptop, for example, usually in the corporate setup, doctors would have a laptop on their table. Simultaneously, they're expected to write patient's information on the laptop. But then they have to make sure that in between, they make eye contact with the patient. And also inform the patient, I will have to feed in your information in the laptop. So I hope that's okay. So that means you're seeking permission. And also make sure that in between you make eye contact and you're not just constantly looking at the screen of your laptop. Appropriate, if appropriate, smile, because not all patients have come with very under distress or they are, really upset. They may have come for even simple issues and you can smile and make their life, easy. Put things on hold. If you're doing something for those few minutes, if you can put things on hold and look at them and talk to them, they really, really feel very satisfied. Lean forward. Posture plays a very big role. How we sit and talk shows how, how much of respect we pay, how interested we are in listening, and how seriously are we attending to that patient. And we'll be talking about it again in one of the chapters when we will be talking about verbal and non-verbal communication at length. We will be discussing this. Then do not do multitasking. So when you're talking to a person and if you're simultaneously looking at phone or if you're looking at your notes, they feel that you are not giving 100% attention. Nod, because when we nod, the other person gets a feeling, I'm listening, I'm understanding, I'm agreeing. So that's one thing I think everybody should demonstrate. Then we have to avoid interrupting. Even if we have a question to ask, put it aside. Ask when the person has completed and then ask your question rather than interrupting and asking the question in between. So I think we have done this activity and you have seen that listening in healthcare as it is very, very vital, because we know it can be disastrous if we make mistakes in listening. There can be wrong dose, wrong patient, wrong route, wrong timing of the medicine, and it can break health. So we have to be careful not to miscommunicate or communicate in a wrong manner. I think we have done this activity. Okay. Moving forward, fourth skill that every healthcare provider need to have is positive attitude, helpful attitude. Any idea what facial expressions normally we have when we interact with our patients? Number 1, 2, 3, 4, 5, 6.
I think
Generally, it
5.
is 5.
Number 5. And what is that number 5?
Poker face, no expression.
Yes, no expressions. Exactly. And this is not just one person. Right from the security guard to the doctor, everybody would have this face. And what exactly does that mean?
It's a
Not
motivity,
interested.
Not
routine,
interested.
routine affair
Yes.
of life.
Yes, I am doing my duty. That's all. And we deliberately.
What else is new?
Yes. And we have this face on this expression on our face. Stay away from me. Don't ask me a lot of questions. Don't talk to me. I'm not interested in talking. So, incidentally, facial expressions communicate your attitude. So, your willingness to engage in conversation is visible on your face. And if you have this kind of face, that shows that I'm not interested in talking to you. So, if you want to show positive attitude and willingness to help, I think we need to have better facial expressions. Okay. The fifth and the last one is empathy. And empathy, I think this is the greatest tool to create solidarity, even if there's a language problem, even if there's a cultural problem, anything. I think empathy does not require any language. So empathy is when you put yourself in the patient's position and look at things from their point of view. If it was my son who was not well, if it was my father who was not well, how would have I felt? When you put yourself in their position, you're able to look at things from their point of view. And then you are actually able to see their world. You will not be judging them or labeling them. You will understand their feelings and you will communicate with those understanding. I'm so sorry. Let me see. Sorry. Okay. So if we can bring this in our communication, I think the communication is already made. The rapport is already made. The patient is all yours. By the way, what are the barriers in expressing empathy? Why do we not express empathy?
Maybe awareness. We don't know that we need to, and this is how we need to.
Maybe this is also a good answer. Beauty, I agree. Sometimes we don't know the importance of expressing empathy. Very true. What else?
Ma'am, the personality trait of yourself that you are actually not empathetic in any way, either in family, friend, or other. You are
not in the habit of expressing empathy.
Lack of sensitivity.
Lack of sensitivity. Very right. Yes, that can also be a reason. Any other reason do you think?
Because pain and suffering, doctors see day in and out, so it's become routine for them.
For everybody. And why doctors alone? For everybody. I mean, even the support staff, they are sometimes insensitive. The security staff, sometimes they're very rude to the family. They can see the patient dying, they will not let the patient's attendant go in. I'm not saying that they should be allowing them to go in, but how they handle the crowd, that shows that how sensitive they are to the suffering of the family. So there's a huge difference between sympathy and empathy. So when you are interacting with your healthcare providers, you have to help them understand the difference between the two. Because sometimes they think, oh, being empathy means I'm attaching myself with the patient and I can't take so much of burden. So why the hell should I take this pain with me? So let me be just detached. So being empathetic is not attaching yourself. Empathy is an intellectual cognitive process. It's an effortful. You are working with understanding. And the ultimate aim of empathy is you want to understand patient suffering and see how you can help your patient. How can you reduce their suffering? How can you be of good help to them? So there's a difference between empathy and sympathy. And I think we need to be clear, and then we need to transfer this understanding to our patient. So these are the 5 skills. So I have deliberately, excluded all other 5. I mean, all other skills, although there are so many of them, but if you can help them see these 5 skills, if they can have in their pocket like a hanky, trust me, most of them will be able to handle their patient effectively. The last video that I want to show is on empathy. Maybe some of you have already seen it, but the idea is normally this video stirs them up, and they get to understand how important it is to behave well with the patient. So let me show you this video, and then we have the discussion forward. And I think we are do I have the video here? No, I don't have the video. Give me 1 second. Yeah.
Goosebumps, ma'am.
I must have seen this almost 1,000 times, but every time I see, I feel the same feeling.
Ma'am.
Yes, please.
Yes, ma'am. Ma'am, sometimes even one sentence of yours is going to change life for the person. This I have felt during COVID. Attendance of the people, father of young son who has passed away in COVID, and he was running from pillar to post for taking a claim. So he wanted a death certificate, and he didn't know which place to go. And finally, I took a piece of paper and written that there is a medical record department where you have to go and just give an application and you will get it. So that was one those three letters MRD. But when that person came back and this thing, so that was a very engulfing feeling. Yeah.
I'm
That's
sure.
how things
I'm
went.
sure. See, normally I tell to healthcare providers, you don't need to go to temple or church or mosque or anywhere. This is your Karambhumi. Send your patients happy, satisfied. You don't need to go anywhere. You get the result of your good karmas right here. And I just don't say this, I believe in this blindly. I don't do a lot of prayer, but when I do my work, like even if I'm doing this program with all of you, all my intentions are to give you 100%, to empower you with 100% ability, so that tomorrow you can go and do your job in extremely, extremely satisfactory manner. And trust me, last 10 years has been a big, struggle for me, because as all of you have seen, communication are not taken seriously by people. There are not many takers, but only with your good work, dedication, passion, you can make a place for yourself. And that's the only way out. That's the only way out. So with this, though I've given you 5 skills, again, you can customize your list according to your clientele. If it's a medical student, maybe you would like to talk about respect and treatment of equality, because there we see sometimes they don't treat the patient as equal. So you can remove one, maybe prompt attention is not required, building rapport, then a positive attitude, listening attentively, respectful and care with dignity. You can tweak it. So I'm not giving you the final list. You can modify the list.
So ma'am, we can have a list of various the communication modes or methods wherein we can then juggle between the various techniques.
Yes. So again, depending upon the group that you are addressing, the training needs, when I'm going to talk to you in the next session is on how do you design a training program. If you are able to get the training needs from your organizer's mouth, you will know what I need to address and how I need to address. It can be an activity, it can be a questionnaire, it can be a role play, it can be anything. Because in the next session, we are going to talk about different facilitation tools. And each one of you, I'm sure, will have a well-set tool for you. And if we all contribute, we can make a bank of it. Somebody may be wonderful at storytelling. Somebody must be wonderful at role play. Somebody must be really good at, doing some mimicry or something. So we'll pull that up. And then each one of us will have access to that. So I'm going to try a mechanism where we all collaborate and, be available for each other. That's the whole idea. So I've given you this list of 5. There are so many others you can think and you can design your. And with every practice, your performance will go up. It'll become better. It'll go up. So with this, we end this session. Any questions about it, any feedback that you immediately want to give? Of course, I'll be giving the Google form link with you to give your feedback immediately. Renuka, you seem to be very tired. I'm really sorry. I know you had a long day.
Got up early, came back just in time for the session. Sorry.
Sorry. No, I can see that you're very tired. Do you want to have a cup of tea or little water?
No, the others had dinner. I'm just waiting to have Mine is not an issue.
Just 5 more minutes and we'll close. I'm really
No,
sorry.
but I should also say that there were times like when you have practiced what you're preaching today, I have personally sought your opinion and guidance. I think you will remember. And all this listening and empathy and all is what you are very good at. I have called you 2-3 times and we had had a good discussion. So I think it just goes to say that, and that makes me all the more meaningful for me to be here today with you and learning from you.
Thank you so much. Thank you for all the praise. I hope I come true to your expectation and really, meet everybody's, So, yeah, please.
Sorry, please don't take it. I would like to say one more thing. Like we have got 2 sessions now, and there is one more thing when we do this together. After the end of it, and it gives an immense feeling when one of us will attain certain period of standing in this field, and it gives immense happiness. So when I have done my hospital management time, and I was privileged to meet sir also and other, and in my institution, one of batchmates from a national level comes and he's greeted this thing, so it gives that kind of feeling. So if all of us can have something, one day we should be able to attain that, and it will be serve that purpose, and that passion will come automatically.
That's the purpose. I think that's the purpose of Master Trainer program, that I want to see you all in good standing and doing this very important vital job for healthcare. If not for anybody else, for the patients, for the society. I think that's what we need to do. And again, finding fault, blaming anybody, that's going to work. I never did this with any group of audience. And I think that is what has helped me, get acceptance from my audience. I don't find, blaming or finding fault helpful in changing a person. Just empower them with the right skill, leave them. They'll come back to you saying, I'm happy. I've learned a lot. This is what is my philosophy of therapy. So I don't blame corporate sector or a government sector. Everybody has their own set of challenges. We don't know because we are not there. So how do we know what their set of challenges are? Any feedback or anything that you want to ask or say, Gurleen, Beauty, Bindu, Isha, Mayuri, anybody, if you have anything to say or ask, please go ahead.
Yeah, I wrote in the chat also, ma'am. If we can just do it a little earlier, because I feel bad that everybody's doing their work and I'm not helping them.
I think 6 to 8 morning work for many of them, because they're all working and they reach home by 8 o'clock.
Okay.
It's only their passion for this subject that in spite of having a long day, they still want to attend the program. But I can tell you, it's worth the effort. If you want something, you have to sacrifice something. This is what is my trust in my work, and this will pay you. And it's okay. I get up at 4 o'clock in the morning to prepare for my program.
No, nothing for me, but
I'm 60. I am 60. If I can do this, all of you are much younger to me.
Ma'am, I just want to add on it. When you show eagerness, you show that at any period of your career or age or anything, you show that extra mile that you are ready to walk on. Yeah. Then people around you also want to support you. So that is one of these things which keeps on you going. And it's not for a lifetime. It's a matter of 10 sessions. So it's worth doing it, ma'am.
Thank you so much. Thank you so much.
Indu ma'am, before we end, I would again apologize to Samira ji. Ma'am, it's really hurting me because that's not me and I had to do it. And Samira ji, I have very high regards and respect for you. So please forgive me. If you have, even for that one moment, if you had felt that I was not.
No need to apologize. I understand that you are playing the role of not listening. Thank you so much.
Yes,
thank you so much.
And Indu ma'am, these were the 5 skill sets, the essential skills that we had discussed. If we could, as I just some time back also asked, like if you could get the whole lot of skill sets, and then we can put it up into the different groups wherein we would be definitely training them. So that would be a great help, ma'am.
Dr. Santana, I'm not sure if we can really list down everything, because again, it depends the kind of clientele you are handling, kind of culture you are working in. It will come with experience, but then there are a lot of things that we are going to discuss in the coming chapter, in the coming session. So you will be able to find out, okay, this is the problem I normally see with this hospital. So I think I have to talk about this skill. Like I said, assertion. Assertion is one skill which most of the healthcare providers are missing. I received a phone call from a doctor 2 days ago. She's working in one of the best hospitals of India. She said, I've resigned just because I am not able to get along with my team. When I went into the detail, I saw that she was into passive aggressive mode always. So she was not able to communicate what she wanted to say, and she would withdraw herself and then go, sulk and then blame people. And we work together. Same way, you will get to know these skills when we will be, having more sessions. And then we can also try to write the number of skills. I think if 10 of us, 11 of us start writing, each one will be able to give us 4 or 5. We will have 50, 60 skills in front of us.
Okay. Thank you, ma'am. Thank you.
I could not attend the entire session on this Sunday. I wanted to know what are the fixed day and timings now?
Yeah. So we are planning Tuesdays and Saturdays, one working day and one weekend, so that we don't occupy both the weekends. Saturday, Sunday, both are not the right days. Timings, I think 8 to 10 are okay for everybody. So I would request everybody to cooperate and, to understand that we are all here for one purpose. There may be some adjustment required here and there, but then I request to cooperate. So Tuesdays and Saturdays are final. Other than, for example, I think 31st is, no, 31st is, no, next, 1st January is Saturday. So maybe, I don't know if you want to have the session on 1st January. Maybe that
25th also.
Yeah. 25th is also a Saturday. Yeah. So that way, if you want to, change a day, we can discuss every time. But otherwise, I think Tuesdays and Saturdays are fine. But these 2 days, I think we will have to reconsider. If everybody's busy on Saturday, 25th, then maybe I'm okay. For me,
we can do it on Friday.
All the working days are my prayer, puja, celebration. So for me, it's not a problem. So
I work Monday to Saturday, so this getting that 25th on a Saturday is a rarity for me. So planning a small break with the family. So
we can.
Just that weekend alone.
So maybe 24th is okay, ma'am. 24th we can do it.
We can.
Tuesday and Friday.
We can do if it suits everybody. 24th is okay. Although I have a long day. That day I have a session at MAMC, but I am okay. I'll have 9 to 4 there. So 8 o'clock is fine with me. I'll get 2 hours break. That is good enough for me. So we can have it.
Ma'am, for me, any day, anytime, no issues.
That should be the spirit. Thank you. So next session is on 18th December. That is coming Saturday. And it will be on how do you design a program. Please read and come with your training, your organization's training needs, so that we can incorporate all that and come up with some template. How do you go about, designing your training program? So are you okay with this topic?
Yes.
Dr. Samira, are you okay with this topic? Because you're already a wonderful trainer. So I don't know if this is okay.
No, I am so excited to reach this topic. Thank you so much.
Thank you so much. Wonderful. So thank you, everyone. I'm sharing the Google link form for the feedback. It's a small feedback, so you can give it right away. That will help me. And also in the last suggestion, you can write the topic that you want me to cover, because then I will make sure that I cover that topic. Give me 1 second. Okay, so I share in the chat box. Is that okay? Done. I've shared.